it is not simple really to understand how is the impact, how really the measures that we're implementing in the built environment are really affecting the people living in the buildings and in the cities. It is something that is still subjective. It is the perception. It is always something that we think is happening to others.
The return is not so clear as when you want to promote energy efficiency. I mean, the improvement of the quality of life of people is something that is checked during a lot of years, so it's not so immediate.
Most buildings and infrastructure will be there for the next 30 to 50 years. So as governments invest, we really need the private sector to be proactive and advance and deliver buildings that have inclusive, human-centered approach where health and well-being are at the core.
Housing conditions, public spaces that are inclusive and accessible and that promote healthy lifestyles are key aspects for the promotion of true health and well-being in citizens.
Measuring productivity, measuring how the value of the spaces that are really addressing health and well-being in an effective manner with the strategies that are visible and they're understandable, and how that impact the value of these spaces, for example, and how people start reporting on health benefits that are perceiving in their own bodies.
Achieve the involvement of the public administrations, that they are really aware of what could be achieved if we all push for the same things, and also to ask citizens to ask for it. I mean, I think that we as citizens, we have to have an active role in this, and we have to ask for it to the politicians and to the public administrations.
The leadership from industry combined with the complementary policy and regulation from government is really what's going to be fundamental to sustain change in the built environment for the long run. And this is a sector that represents 40% of the world's GDP.
It is very important that policies and member states in Europe as a whole, when thinking about promoting health, do consider health in this broader sense and not the narrow one, and acknowledge built environments as a key aspect to this promotion.